For our capstone project, we looked at coping mechanisms to help reduce nurse burnout in psychiatric nurses. I am Megan Johnson, and I will be presenting with Lauren Turschak. Throughout research, it can be seen that high levels of burnout affect over 50% of mental health professionals at an early stage of their career. High levels of burnout can be seen throughout the medical field, especially psychiatric nursing, due to high-stress environments. The purpose of our education session was to educate psychiatric nurses about coping mechanisms to reduce nurse burnout and decrease work stress. We presented a 20-minute presentation at UCMC Ridgeway involving a pre-post test to nurses on the target unit. Throughout the session, nurses were able to learn how to accurately and efficiently use the coping mechanisms and relaxation techniques. When we were coming up with a topic to cover, burnout stuck out to us because of how prevalent it is in the medical field. As nurses, the things we see and go through put a toll on our mental, emotional, and physical states. Specifically, psychiatric nurses experience things that are hard to cope with. As soon-to-be graduate nurses, we wanted to learn more about how to help reduce our own feelings of burnout as well as our future coworkers. We identified 4 main stressors as acuity level, verbal and emotional abuse, lack of confidence, and dealing with unpredictable and disturbed patients. We decided to create an educational training about coping mechanisms for psychiatric nurses at Ridgeway to reduce their feelings of burnout. These coping mechanisms included deep breathing, practicing relaxation techniques, social support, and positive thinking and mindfulness techniques.
We began our education session by presenting a pretest containing 10 questions to staff nurses. After they were completed, we provided a 20-minute slideshow with pamphlets about coping mechanisms they can use to help reduce burnout rates. At the end of the session, we concluded with a post-test, which was identical to the pre-test, to see if the education helped improve the staff's scores. The findings showed that after the education session, the floor nurses and managers were able to identify healthy coping mechanisms to help reduce their work-related stress. Our pre-test asked questions that addressed coping mechanisms the nurses had implemented before our education session, and our post-test showed significant improvement in identifying healthy coping practices after listening to our presentation. The education we implemented appeared to be effective based on the improvement between the pre- and post-test results. The knowledge-based questions were answered almost entirely correct on the post-test. We also received positive feedback on our presentation, including that they appreciated our topic. It was relevant and applicable to the staff's work lives. Our results clued us in on staff beliefs that night shift and age would contribute to triggering stress, so if we were to make improvements, we would be sure to focus more on educating about stress triggers. Seek mentorship outside of your hospital. A third-party mentor not directly involved in your work can help you navigate stressors within and outside of work-related stress, providing a more holistic support system. Do not let other nurses' burnout affect you. Recognize when your coworkers may be experiencing burnout and maybe you decide to talk to them about it. It is important to protect your energy and not let the way others are feeling affect your mood. Your staff is a team, and uplifting each other can go a long way. Reach out to your management if you are struggling. They have either been in your shoes before or they have helped someone through it. Lastly, have confidence. Be confident in yourself as a successful nurse you are. Do not put unnecessary pressure on yourself to be perfect. Thanks for listening to our presentation and have a stress-free rest of your day.